Namaste everyone, Dr. Meenakshi here. So since many days I didn't posted any videos about any topic, so thought to upload a video today. Today I came with the topic as we are dealing with the series of congenital disorders. So I explained two diseases previously, and third next disease is I am going to explain about the cleft lip and cleft palate. What is this cleft lip and cleft palate? So as we know, moreover not cleft palate, but usually in our surroundings or maybe in relatives or maybe in our colleagues, we will be seeing cleft lip persons, right? Cleft lip means what is this cleft lip and cleft palate? These both are one of the congenital disorders as we know, and especially coming for the cleft lip, in our Ayurvedic term it is known as Oshtabheda. What is this Oshtabheda or Kandoshta? This is the congenital condition illustrating the non-fusion of lips at birth. There will be no fusion of lips at time of birth. This condition is known as cleft lip. In our Ayurveda, in the textbook known as Ashtanga Hridaya, in Uttara Tantra, Acharya explained as Tatra Kandoshta Ityukto Vate Naushto Dvidha Krutaha. Means the Ayurveda attributes this cleft lip as Vata Kopa. It will be caused due to Vata Kopa, and it has the main causative factor. Due to Vata Kopa, there will be non-fusion of lips at the time of birth according to Ayurveda. And the treatment particularly Acharya has explained as in Ashtanga Hridaya explains the management of Lekhana and Sivana for the treatment of cleft lip, that is Oshtabheda or Kandoshta, and can be done Abhyanjana with Taila prepared from Madhuka, Jyotishmati, Lodra, Sariva, Patola and Kakamachi, and the Nasya can be done with the Taila medicated with Vatahara and Madhuraghana drugs. And as the Acharya Sushruta, as we know, he is father of surgery in Ayurveda. He explains the surgery for the cleft lip is nasoplasty. The surgery by name nasoplasty can be done as a treatment of cleft lip according to Acharya Sushruta. Coming for the modern point, as I said, this Oshtabheda or Kandoshta is known as cleft lip in modern part. It explained as the developmental error in the formation of upper lip will lead to the formation of cleft lip. The cleft lip is classified as different ways, several ways, and this cleft lip is a condition that is non-fusion of lips, right? Especially upper lip, but again it have the several divisions, like the cleft lip may be simple or compound, or complicated and uncomplicated, or complete and incomplete, or central and lateral. Several types of cleft lip are simple and compound, complicated and uncomplicated, complete and incomplete, or central and lateral. And in lateral cleft lip also, again it will be divided as unilateral and bilateral. These are the types of cleft lip conditions. And according to modern, they advised the treatment of cleft lip as operative treatment is only choice. There is no any samana aushadis or oral treatment. Operation is only choice for cleft lip according to modern. And the condition of a baby, by seeing into the condition of a baby, we can operate at the age of 3 months or before commencement of primary health dentition, or the baby when attains 5 to 6 kg of body weight can go for the operation. According to modern, when you can operate a baby when body weight reaches 5 to 6 kg, or at the age of 3 months or above, before the primary dentition starts. And the problems or complications from this cleft lip can occur as cosmetic problems, difficulty in sucking, and defective dentitions can occur, defective speech, and deformed nostrils. These all may be the complications of cleft lip. If we neglected or if we ignore, these all complications may occur due to cleft lip. Next, coming for cleft palate. What is this cleft palate? In our Ayurvedic term, it is known as Kanda Talu. That is, the non-fusion of palate is known as cleft palate. The cleft palate is the condition due to failure of fusion of three basic components which together form a palate. Our palate is formed through three basic components. If there is non-fusion of these three basic components, there will be cleft palate. What are those three basic components? The premaxilla developing from the medial nasal process, and the two palatine process, one from each maxillary process. The three basic components are the premaxilla developing from the medial nasal process, and the two palatine process from each maxillary process. If there is non-fusion of these three basic components, then there will be cleft palate. And there are two types of cleft palate, as complete and incomplete. And what is this complete cleft palate and incomplete cleft palate? The two half of the palate fail to fuse in the entire length, so that the nose and mouth becomes interconnected. This condition is known as complete cleft palate. But the fusion of two halves of the palate process from before backwards is a condition known as incomplete cleft palate. In this incomplete cleft palate, the anterior of the palate shows no abnormality, as there will be backward half of the palate will be non-fusion, so the anterior part will be clear. If we see like this facially, we will not find any cleft palate. But while examining of a newborn, when we examine the mouth part by fingering in a mouth, then we will find the backward part of the palate will be cleft palate. So this will be the incomplete cleft palate. Now coming for complications of cleft palate. What all complications we may get if we ignore or if we didn't treat the cleft palate? That is, difficulty in sucking, difficulty in eating, difficulty in speech, difficulty in hearing, and dental problems may occur. Defect in smelling may occur, repeated respiratory tract infections may occur, and chances of aspiration or bronchial pneumonia may occur. These are the complications of cleft palate. And coming for the treatment, how we can treat this? Though as we know, there will be non-fusion by oral medicines, we can't do anything, right? So the option is surgery. Surgery must be carried out at the age of 1 to 1.5 years of age. And the operation of cleft palate, the name of the operation are Langenbeck's operation or Wardell's operation. This Wardell's operation is also known as 4-flap operation. So these two operations can be done for the cleft palate. So this was the small topic about congenital disorders, that is cleft lip and cleft palate. If you have any doubts, then you can comment in a comment section box. Thank you.